because the radiation had burnt away all the blood vessels, anytime they would try to cut or inject anything in there, the skin would start to die and they would have to stop. He had heard about me, he came to me and he said, can you help with your stem cells to correct this problem? And I didn't really know how well it would work. I tried to convince him, you know, let's go slow, maybe let's try it. But he was really gung-ho about it. And he let me do the stem cells on him 8 times over a course of 2 years. What was amazing is that, as you can see, the hole was gone, the jawline was back, and all the burn and pain and the discoloration that was on his skin from the radiation had resolved. And I was blown away by that and really became passionate. And then we were using my stem cell procedure for cosmetic purposes, and we were injecting people, and we were seeing very, very fast changes in the skin within a matter of weeks. Most stem cells or most cellular changes takes months to years to happen. Here we were seeing the changes happening very quickly in the skin, and we said, okay, this is not the cells themselves doing something, it is something the cells are producing. And we said, we need to take this fat into a laboratory that we have and start studying it. So I opened up my laboratory and we started studying the stem cells in the laboratory to see what they do. And we grew the stem cells in different ways. And we found that depending on what environment we were putting these cells in, we were getting different set of cellular factors. The factors that they produce is the language of the cell that they use to communicate with one another. And these factors have effects on our body. A lot of them are for antioxidants. If you grow them differently, they have for wound healing. If you grow them differently, they'll produce factors for improving the skin and so on and so forth, and the hair. And around the same time that we had discovered this, and I had made a cosmetic product out of it, because, you know, to go through the FDA takes a long time, but we saw the improvement in the skin, so we made a cosmetic product out of it, and we were selling it in my office. And at the same time, Randy and Wendy, the founders of this company, walked into my office, and it was amazing. We became very good friends. Randy had problems with his knees. He wanted me to do the stem cell lift for him. We treated him and he got better. And when we were talking in my waiting room, Wendy saw the bottle of the product in my office and said, "What is this?" So I told them the story of how we got the product. And they took a few bottles home and they tried it. And they called me a few days later and say, "Okay, we're opening a company called Jeunesse. We share your vision. We're going to bring this to the world." And that's really what happened and how Jeunesse came to be. It was not a chance meeting. It was a meeting made in heaven. And here we are, thanks to them. And thanks to Scott and Isabel for their leadership to bringing the most innovative products, the most advanced products to you. And Jeunesse has become a global name thanks to them, and thanks to you, the Jeunesse members who work tirelessly. I have never seen people so kind and so hardworking. You're always working, you're always giving your best. You're trying to help to share our vision and our technology to the world. You've made our technology and Jeunesse a household name, and I'm very thankful to you, and I'm grateful for being part of this team. So let's talk a little bit about the technology in the products themselves. There's the hair care and there's the skincare. The skincare product is the Luminous skincare line that is powered by APT 200, and the hair care line, the Reveal line, is powered by HPT 6. HPT 6 and APT 200 stand for Advanced Polypeptide Technology and Hair Polypeptide Technology. Polypeptide technology is our ability to take the stem cells, doesn't matter what the cell source is. It could be human that we started, and now we have the ability to get the same polypeptides from any cell source, including plants. And by putting them in the right environment, they give us the right set of polypeptides. And that technology is a novel technology, it's a new concept in skincare. No one has come close to doing what we're doing in the last 10 years. And this is a true revolution in skincare and hair care. And this is exclusive to Jeunesse. One of the great things about using polypeptide technologies, because it is universally accepted, it is part of us, this is what our cells are used to seeing. It can be used for all skin types, it can be used on all skin colors, and it is good for all parts of the body. Our skincare line has been formulated to work synergistically together. They work in tandem. They all help, they all do different things, and they all need to be used to get the optimal result. The powerhouse of the whole skincare line is APT200, like we talked about. But then there's other things that we need to do, like antioxidants, anti-glycation. Antioxidants are what basically, oxidation is when your cells are breaking down and they're aging. So it's like taking a bite of an apple and sitting it on the table, and you can see like it gets wilted. Or anti-glycation is when the sugars get stuck in the collagen and tightens up the collagen. It doesn't make your skin elastic and nice and supple. So those are important. And a lot of things that happen with time is, or skin problems that we're having, is to do with the imbalance of the skin. So we want to bring back, replenish the vitamins and proteins to protect the skin and bring it back into balance. Another important part of our skincare line is that we make sure that it's not animal tested. I test everything on myself before I put it on anybody else. So I'm the guinea pig here. Then we make sure that there's no parabens, there's no products or chemicals that are harsh, that irritate, that cause acne, or that sensitize you to the sun. We took our product and we tested it by a third party in a way that is done using the most advanced testing technology to measure wrinkles and pigments. And they compared the product within 2 months, had 87% improvement in the wrinkles and 62% in the pigment. And what was really amazing to me was that 100% of the participants said they would continue to use the product and they would recommend it to their friends and family, which I've never seen in any product testing. So I was very proud of that. We also looked at luminosity effect, how brighter the skin gets. And you can see within 4 weeks, we can get a tremendous improvement in the skin quality and the brightening effect. And here's the example of the test that they did to show how the skin gets more luminous over time. This is a patient of mine who was using it, and you can see the improvement in the skin texture, in the skin color, in the skin tone. And before we talk about the individual products, I want to talk about what's happening in the world right now, which is the pandemic. And everybody is trying to wash their hands many times, or use sanitizers many times a day. And it really dries out the skin and removes the protective barrier that you have on your skin. You do not want to take away the protective barrier on the skin, not on your hands and not on your face, no, because you really want that protective barrier to be there to balance the skin and to keep it healthy. All the washing and the sanitizers will take away that protective and put you actually at risk for infection and cause inflammation in the skin. And there's a lot of people right now who are calling me because they've used it and they get, they use the hand sanitizers and soaps, and then they end up having rashes and rawness in their hands. So I'm going to tell you how to prevent that. There's 3 steps to good skincare. One is cleansing. Second is the revitalization of and balancing of the skin with the APT 200. And third is to locking in and moisturizing and protecting the skin. The cleanser that we have, you can use it morning and night. It's gentle to open up the pores, to remove the dirt and pollutants on the skin and the oils, and allow for the skin to be ready for you to apply the rest of the products. But not just now, but all the time. You should always wash your hands before you apply anything to the face, including the cleanser. So you should cleanse your hands with the cleanser and then put it on to your face. The first thing that should go onto your skin after you wash it is the serum. The serum is the powerhouse of the skincare line. It has the most amount of the APT 200. You want to use it morning and night, and you want to massage it in to your face and neck. To see a result usually takes about 4 to 8 weeks, because that's the time you need for the body to adjust to a new product. One of my patients in my clinic decided that she's going to test this. She doesn't believe in the pictures. She doesn't believe the studies. She's going to do it on her own. She went, used it for 1 month on one hand, comes back. She goes, "Oh my God, look, it worked." And then I said, "Okay, good, use it on the other hand." So if you want to use it on your hands, you can do that as well. The next thing that should go onto the skin is the brightener. The brightener is not going to make you sensitive to the sun, so you can use it morning and night. It doesn't have any harsh chemicals in it. It has actually those polypeptides that help reduce the discoloration. And it has, when you take a pump of the brightener, you will see little white spheres in there or dots in there. Those are supposed to be there. When you put it on your skin, it will become incorporated into the skin. You won't see it anymore. It will get absorbed. But that's important to know that that's part of the product is meant to be there. I'm going to just show you a couple of pictures of other patients who use the products, and you can see the improvement in the skin. And once we did the treatment with the skin, we need to now moisturize, seal it in, and protect it. The daily moisturizing complex is got SPF of 30, which protects you from 98% of the sun rays. I did actually one of the first studies on Parasol 1789, which is the product that blocks the UVA rays. And that's really part of that study was how we figured out that this SPF of 30 is what you need, because that's 98% protection. Now, if you're going to be in the sun a lot, you want to put on the product more often. So if I go out with my family and we're in the sun, I tell them, reapply this every 2 hours, because you want to protect it from the sun if you're out in the beach or in the pool. The next product is Advanced Night Repair. This is a little bit more rich. It's a little bit more moisturizing. So if people are feeling dry and they're not getting enough moisturization alone with the daily moisturizer, you can use the Night Repair on the skin as well, not just at night, but during the day. But it's the only product that in the world that has antioxidants, anti-glycans, and APT 200 in one product. So this is a very unique product, and I think as you use it, you'll see the benefits over the course of a few weeks. You can use it on your hands, but I prefer if you start with the body renewal, because this one has the APT 200 vitamins and antioxidants for the body. And every time you wash your hand, you or you sanitize your hand, you should put on the body renewal right after to moisturize and to make sure you don't lose that protective layer. The ultimate lifting mask is a very gentle cleansing mask and moisturizing mask. So the exfoliating effect is to take away the oils, the dirt, and the clogged pores. So you can use it, it's gentle that you can use it every day, but at least once a week you should put it on. You put a thin layer on, you let it dry, and then for about 20 to 30 minutes. Once it's dry, you can peel it off and wash with warm water and then apply the serum and the other products. Some people tell me that they like to leave it on overnight. If you want to leave it overnight, I suggest you put on the serum first, then put on the mask, sleep, and then in the morning wash it off. And I would put it on, not just on your face, but I would put it on the face and neck. And one of the great things about this product, it gives you an immediate lifting effect. So if you're going to be on a Zoom call, or if you want to go out and you want to look your best, this is the perfect product to put on, and it gives you that lift for about 6 to 8 hours. You will see your skin is a little bit more firm and lifted. The HydroShield mask was made to protect you during the day from the pollutants, because we know pollution is one of the causes of aging of the skin. And if you put this on, you want to put the serum on, then you want to put the HydroShield mask on. Once you take off the mask, a sort of a mesh layer is left behind that traps the pollutants into that layer. And when you wash it off at the end of the day, that those trapped particles wash off with that layer that's been left on the skin. I'm going to show you some pictures of Jeunesse members who send us some of their pictures, and if you want to share your pictures with me, I would love to have them. And this is really what drives me, knowing that we can help people and improve their lives. Neck is one of the hardest areas in the body to even do cosmetic surgery on and to get a good result. And just with our products, you can see the neck is much firmer and much better. This one is about getting the color and the inflammation and everything evened out in the skin. She actually started using the products, and then believed in it so much that she became a double diamond. Even in young people, you can see the skin is not completely smooth. It's got a little bit of bumps. And as soon as you put it on and the polypeptides start working, you can see the skin sort of evens out and becomes much nicer and smoother. You can see the changes in skin elasticity, in skin firmness, in the wrinkles get much better. Here's another person that showed me their picture, which was pretty incredible. The funniest woman that showed me her pictures was in Australia. She comes up to me, she goes, "Look at this picture. This is me and this is my mother." But it's not really her mother, that's her. It's just 6 weeks, what a big change in the products. I was blown away by this picture. So let's talk a little bit about hair. 9 years ago, I started losing my hair, and I said, I need to figure out a way to do this. I looked at what's out there. I tried everything that was out there. Nothing was working, and there was nothing new. And for the last 30 years, like, there's nothing new in the market that really has come for hair. And I said, our technology has to work. So I started testing all sorts of things on myself for the last nine years. And obviously, it's not working too well for me because I don't have the follicles. But one of my nurses started having some hair loss and was really distraught. She wasn't her happy self. She sort of became really sad. And we said, okay, let's try the product on you. And let's try the latest version that we've made and see how it works. She put it on, and within 2 months, her hair was back and she looked happy again. She was very excited to see the changes, and she continued to use it because she liked it. And a year later, we look at the pictures, and her hair was amazing. It had, more volume, more luster, it just looked so much better. So I said to her, okay, if this is working for you, it's going to work for thousands of people. Just because it didn't work for me doesn't mean we shouldn't bring it out. And that's how we created Reveal. Reveal is the most advanced hair care system in the world, hands down. And I'm going to prove it to you, except I can't show you any before and after pictures because the regulatory told me FDA doesn't allow us to show you before and after pictures of hair. So this is a study that we did on stem cells for hair and how they are involved in hair growth. And we published our study in the medical journal here. And we chose 6 plants that are known to have hair effects, positive effects on the hair. And we studied them in the lab. We studied many other ones, but we chose these 6 because we saw that these 6 work the best to give us what we want to do. In the top, you'll see the blue dots are stem cells grown in normal condition. In the bottom, the blue dots are stem cells grown in HPT6. There's no change in the stem cells in the top, and in the bottom, you see the change is going towards hair. That's change for hair. So we knew that it worked in the lab. We saw it worked on my nurse, and then we tested on other people in my clinic, and we saw that it works. And we did a clinical study, which I'm going to share with you in a minute. And we developed HPT6, hair polypeptide technology. And it's really there to strengthen your hair, to build the volume, to build the sort of the vibrance of the hair back. It's good for all hair types, even if you chemically treat your hair or color your hair, all those things damage your hair. So you want to use the products that will help restore the health of the hair back. And this is what we've designed here. The shampoo that we have does not contain HPT6 because that gets washed away, but it does contain specific plant extracts that we put in there, like shikakai, fenugreek, and linseed oil, that will help improve the shaft of the hair, that will help improve the quality of the hair and take away all the sort of junk and oils that get stuck on our hair over a day. I understand not everybody washes their hair every day. So when you do wash, use the shampoo. But even if you don't wash, you want to use the scalp infusion treatment morning and night. This is the powerhouse of the hair care system. You want to take one of the ampules, you shake it, you put 2 to 3 pumps onto the scalp, and you massage it in. You don't put this on the hair, you put it on the skin of the scalp and you massage it in. You want to do this for at least 3 to 6 months before you can say if it's working or not, because it takes time for the hair to grow and you won't see all the changes in a matter of a few days. It will take some time to see those changes, but you want to put this on and massage it in every day and every night. And then we've developed a leave-in conditioner. The leave-in conditioner was made specifically so you don't have to go in the shower to use it. And I want you to leave this on because it has the HPT6 and it has the plant extracts that will help improve the hair, to give it the shine, to get rid of the dry ends and split ends, and to help maintain the root and the shaft of the hair very healthy and strong. So you can put this on wet or dry hair and massage it in, and then you can style. This is the clinical trial that we did for the Reveal product, and most of the things that were used before, you would have to use it for up to 2 years before you saw any improvement, and you had to, and after that, they would only see it in 1/3 of the people that were treated. So 2/3 of the people didn't see anything. In our clinical study, about 80% of the people saw improvement in their hair quality. And this was already within the first few months. I think the study was about 4 to 6 months. So this is a very big change in terms of how our product is different versus what's been there in the past. I'm just going to show you people who are using the product and how much the hair is improved, the quality of the hair, the shine of the hair, the fullness of the hair. And, you know, as you keep using it, you will see the benefits over time getting better and better. I want to thank you for your attention. Please share your stories with me, share your photos with me. And we're going to be going for the next 10 years and making it the most incredible decade to come. And I look forward to doing it with you and seeing you in person in the next Jonas event, hopefully very, very soon.
Thank you very much for this incredible presentation. It was awesome because we're using the product since 6 years now, to be honest. And I can confirm, like, my wife had an amazing before and after, and I have to send it to you. Because she literally changed her whole skin within only 28 days. And it's amazing. I will send it to you. And if any one of you has like a great result, please put it in the chat, either here or on Facebook. And don't forget to send it to Dr. Newman. We've just seen your email address. It's not his private one, by the way, okay? Just to make sure. So we will share it later on in our chats, because we actually have a testimony website where we're collecting everything, and we give you full access, send you everything over, because we have such incredible results. I do have a question before we open the Q&A. So first of all, like, just out of interest, I don't know if you can talk about it, but why is that regulation from the FDA? Is there a specific reason, or?
For the pictures?
Yeah, for the pictures.
They told me that any pictures that showed the hair improvement can be, like, they consider it a drug if we show that the hair is getting better. That's what I said.
Okay. And as it's not a drug,
it's not a drug. We're a cosmetic company.
That's interesting. Okay, we'll leave it like that. Okay. Would it also work with beard? That's a question I get a lot, because I live in Dubai, and in that culture, the Arabic culture, it's a lot about having full beard. And everybody asks, does it help? Does it help? Do you have results with that one?
I haven't tested it, but I know that on people like my nurse who lost some of the hair, and people get the same issues on their other parts of the body. And if they use it, they should see an improvement in the fullness of the beard.
I'm glad your nurse didn't grow a beard after using it.
She didn't use it on her face.
Awesome. So what we're going to do, guys, now is we open a Q&A session. Very important. No health questions, okay? Please, no questions to any kind of diseases. Dr. Newman is not allowed to answer those kind of questions. So just make sure you ask things about the product and so on. So first question, how often do you recommend to wash the hairs weekly?
This is a personal thing, and it has to do with, you know, a lot of it has to do with culture. Some cultures wash every day. Some cultures wash, you know, once a week. Some people do it, you know, when they do their hairstyle, and they do it every 3 weeks. Just depends on the person and the culture. Some people, if they get a lot of buildup of the oil and dandruff, they should wash it more often to get the hair back in balance, the scalp back in balance. But most people don't have a set regimen for washing your hair. A lot of it is cultural. I wash every day. Some people wash once a week, it's fine.
Cool. Here's a question in German, which I have to translate, but that's a very common thing. A few people, specifically those who are elder, say that in the beginning, the skin gets a bit dry before they get great results. What's the reason for that one?
So these polypeptides really are trying to change the balance in the skin. So you go through sort of a toxic event in your skin that makes it uneven. What this does is corrects that. So you get a detox effect. And when you get that detox effect, this is what happens. Some people get redness, some people get little dots. What I generally have found to work the best is if you do get something like that, you should stop the product for a week or two, let it go so that detoxification is gone, and then you can reapply the product and it should not happen again.
But it's super interesting. Everybody's only asking about the hair product. Nobody's asking for skin right now. I only see reveal, RVL. Here's an interesting question. Does it work with afro hair?
Okay, so all the peptides work throughout because those are universal. The peptides that we have are universal. Every person has the same peptides. All your cells in the body are using the same language. So yes, it works for every culture, every ethnicity, every hair color, every type of hair. It doesn't matter, if you're African or if you're Asian or if you're European or Latin. We all use the same sort of, our cells work the same way, and the polypeptides work on the cells the same way. So it's universal. It's a good question.
Another thing which appears quite often. So when somebody has, and I don't want to use the word reaction because it's not really, I don't know, maybe you have a better word for it, but specifically when people use the cleanser the first time and they have never used any high quality product before, the skin kind of reacts to it. Is that something common, or is that only in Italy and Germany?
I'm not sure what they mean by react.
Like it turns red a little bit, or it can be itchy in the beginning. We had that a few times, and interestingly, it's only in the regions of like Central and Southern Europe. We already thought maybe it might be the water, or no idea.
So the cleanser is trying to remove the dirt and the oils that are built up on the skin. Some people, if they're dry, they will, when they put it on, they may feel that it's drying them out, or they may feel, and that may be causing the itching or that feeling that it's maybe a little bit red. If you're feeling dry already, you should use more of the moisturizer so that, like we talked about, to balance the skin. You want to use, if you feel dry, you should use the night cream in addition to the day cream.
Well, one thing I can definitely say, because like since 6 years we promote those products, and it does not matter if like one of the very, very few people who said my skin, let's call it, reacted somehow. After 1 month, everybody was so happy because at the end it always turned out to be beautiful and people continue using the products.
Yeah, is the process of resetting the skin to be in a healthy balance. That's the key. And I think some people go through it faster, some people go through it slower, and that's why you may need a little break of a week or two in between the products to let the body go through that process.
Here's a very interesting question, because we had Dr. G already on, we had Christian Drapeau already on, we will have Dr. William on, and that's one question we ask everybody. What do you think? Why is stem cell technology still not so popular worldwide? Because you have been since the beginning working with stem cells since 2009, right? So how do you see the evolution, and why is it such a slow process?
Well, I've been doing stem cells for 20 years. And when I started doing stem cell research and doing the treatments, and I presented it to the doctors, I had to explain to doctors what stem cells are.
Mhm.
And to this day, a lot of doctors don't really understand stem cells. And there's a lot of misknowledge or misconceptions about the types of stem cells, because everybody was talking about embryonic stem cells in the beginning. 20, 30 years ago, everybody was talking about embryonic stem cells, which had ethical issues, had lots of problems just using it. But that's not where we are today. We're using your own stem cells. We're using plant stem cells. We're using stem cells that are just producing these amazing polypeptides that are changing medicines, a revolution. And like any revolution, there's people who understand it and accept it and want it, and there's people who resist it. And the people who are trained with the old way are resisting it, and people who are told about stem cells being dangerous because they didn't understand what it does. If we have time, I'll give you a perfect example of what stem cells are and how you can take it to one way or the other. I
Do that
don't
next
know.
Bora Bora trip. Yeah, we have time for sure.
There was a case that somebody injected stem cells with calcium into somebody's eyelid to rejuvenate the eyelid, and the person in a few weeks started feeling clicking in their eyelid, and they had to go and take out the calcium that was trying to make bone in the eye. And everybody said, "Oh my God, stem cells are dangerous. What are you doing? You shouldn't be putting it." And then I had to go and for 2 years educate the doctors, saying the stem cell did exactly what it was supposed to do, because that's the signal you gave it to do. You put it next to calcium, it sees the calcium, gets a signal, make bone, it made bone. Just because you didn't understand what stem cells do, it doesn't mean they're dangerous. It means you're dangerous.
I like the last sentence. You are dangerous. Cool. One very common question. Some people would love to use the whole product line, but they cannot afford it. So which product would be the #1 product you would recommend?
Serum, hands down.
Oh, okay. That's
The
very
serum
clear.
is the powerhouse of the whole. Everything is built around that.
Mm-hmm. Amazing. And last question, and then we're happy to let you go, is for young people. People always ask, okay, it's the stem cell thing, and can I actually start using it because I'm 17, I have acne coming out? Is it possible for younger people as well?
Yeah, because if you're having acne, it means your skin is not in balance. You want to balance your skin so you don't have the acne and you don't have the acne scars. Now, it's not an acne treatment, but definitely it's part of that regimen. You should be doing the skincare, especially the serum and the sunscreen, so that you don't get discoloration, that you don't get the dryness, and you don't get too oily.
Perfect. Thank you very much for your time.
Thank you.
So super, super great to have you. And people are still like asking many questions. No worries, guys. Many of those questions we will answer afterwards in the German version. And in the future, yes, we will have some German explanation. Please send all your questions you have just to an email. We're going to filter them. And whenever you have time to answer some of them, please do that, because people are super excited to get more knowledge about it. Yeah. Awesome. Once again, thank you very much, and hopefully see you soon. Usually we say at the beaches of the world, but this time maybe it would be cool just seeing you live somewhere in person instead of online. Cool.
Thank you very much, everyone. Thank you for attending.
See you soon. Thank you.
Bye-bye.
Okay, guys, so we're going to switch to German language now, just to give a quick wrap up of the whole knowledge he just shared with us. And for everybody who does not understand German, now's the time to leave the chat, as it would be kind of boring maybe. I'm going to turn down Facebook as well, just as I'm not a doctor and I don't want to do any health claims which fly around accidentally, I'm talking about, obviously, which fly around on Facebook or online somewhere. So thank you, everybody, tuning in on Facebook. If you found that one interesting, just share it. This was Dr. Nathan Newman, stem cell expert worldwide. and it was a lot of fun having him.